Hello and welcome to HFMA Talk. I'm Mark Orchard, Chief Financial Officer at Portsmouth Hospitals, and in this episode I get to connect with someone that I've admired from afar for quite some time. Her name is Nicci Briggs and she's the Chief Finance Officer for the newly created NHS Cambridgeshire and Peterborough Integrated Commissioning Board. Lots of you will recognise Nicci, not least because she currently holds the NHS Finance Director of the Year award, an accolade she received in a very worthy fashion at the most recent December 2021 HFMA Awards ceremony. I think you might enjoy this episode, not least because Nicci is much more than your average CFO, and as a little bit of a spoiler alert, one of Nicci's first employed roles involved both saving lives and stopping any heavy petting. But we'll get to that in due course. For now, kick back and enjoy HFMA Talk in conversation with Nicci Briggs. Nicci, good afternoon. How are you doing?
Afternoon, Mark. Doing really well.
Already in this podcast series, I've had the great pleasure of talking to many people, Nicci, as I'm sure you know. We've spoken to Hardy Verdi, Sandra Easton, Paul Baumann, Alan Brace, Julian Kelly, Owen Harkin, Bill Shields. But you are the very first ICB CFO that we've had on the series so far. So why don't we start right there in terms of your new role? Tell us about your new role. Tell us about your ambition for Cambridgeshire and Peterborough as one of just 42 integrated care boards that were established on the 1st of July.
That's a big introduction and great company to be in, isn't it, really? And it's going to be a really interesting, exciting time, I think, as we move into the new way of working across the NHS, and also for me moving across to a new role in Cambridgeshire and Peterborough. So new system, new organisation, new area. And obviously brand new organisations as we're all establishing those 42 integrated care boards. I think for me, this is a real opportunity moment for the NHS. So it's a real opportunity to bring collaboration to the forefront and to actually manage from a financial perspective, business, operational, as a true system. So I think that Joe Public patients just see the NHS, they don't see those organisational boundaries, and the better we can get at making sure the way we set ourselves up is the way that the public sees us, I think is only going to be a positive. I think there's some real challenges financially, being one of the big ones, constrained resources. So it's great and easy to be in partnership, isn't it? While everyone's pulling in the same direction, but once you put a constraining factor in like finance, I think it's going to be a tricky conversation to have. But hopefully, again, the focus needs to be on that integrated care, better pathways of care, and how we can look at funding flows across those pathways rather than into organisations. For me, I think it's going to be a challenge for finance professionals to work differently and to break down those commissioner provider barriers. So I think for me, it's how do we move in that ICB space into enabling functions and that business partnering function rather than the typical commissioner provider relationships. I think that almost has to go immediately for us to really see benefits. I think from a CFO perspective, it's people that can gain consensus to negotiate and work with the providers who ultimately are the ones that deliver the care to patients, and how we can look at system first as a priority rather than just organisation, collection and collection of organisation priorities. How do we actually genuinely put the patient at the heart of what we do? I think the other challenge for me is around health inequalities, how we put that at the heart rather than it feels like we at times can sometimes just pay lip service to it. So how do we as finance professionals, genuinely start to look at allocative resourcing models and things like that will help to drive up that health equity and reduce health inequalities. If we were talking at true integration, how that integrated care partnerships start to work and how we work with local authorities. Health and social care need to be close. So I think those are going to be really critical areas for us. And it'd be remiss of me not to, talk about the one challenge that everyone seems to be highest on the agenda, which is our elective care, and how do we work as a system to support that, and at the same time looking at building back better, care closer to home, more efficient practices, how we get transformation at the heart of what we do. I think those are the responsibilities of the ICB, and to break down a lot of that bureaucracy. I think if the first thing that we do is re-establish all of the hierarchies, we've really got it wrong, haven't we? So we've got to take the opportunity to work differently and really run with it. But that will require people to be brave, because we have to move into a space where we're not all comfortable in terms of talking about system funding rather than how we allocate that out to organisations.
Yeah, well, Nicci, thanks for a really comprehensive intro into the world of ICBs there. But and of course, it'd be really easy to trick ourselves into thinking that the only people who are affected by this are those that are directly employed by ICBs or those previously in commissioning organisations. You touched on providers still delivering care and the whole sort of system first arrangements there. Can you give us a feel for how you feel providers within your system and indeed across the country need to perhaps respond differently to this change from July onwards?
Yeah, I mean it's interesting to spend many years working for a provider, and at that point you're very much head down, aren't you, in the here and now, extremely reactive, and quite rightly so, given the emergency pressures, and then obviously the very large elective backlog that almost every organisation has got. So I think for me it's constantly trying to ask providers to find the time to lift their heads up and say, how do we not just manage today but plan for tomorrow? And I think that providers got a real big opportunity to influence the agenda, particularly at place, and through those kind of provider collaboratives, and really bring patients and integration with primary care and other sectors closer together. So how do we look at that from a place perspective, which is where I think a lot of the health inequalities work needs to sit and feed through. But as I say, it's being able to support providers to lift their head up. How do we genuinely do the integration through those provider collaboratives? And I appreciate each system will probably set themselves up slightly differently. And I think the other bit as well is for all of us to have a bit of patience, because whatever we set up today is probably not what it's going to look like in 3 years' time. And it's a point of, you could spend the next year talking about governance, or you can get on and do and try and work your way through it as you go through the agenda of operational performance delivery and then the more strategic planning.
Can you give us a feel of scale for Cambridgeshire, Peterborough ICB in terms of population, and annual resource limit, number of places you've got? Just give us a feel for what you're dealing with there, Nicci.
Yeah, you're testing me now, given I've not quite started the role just yet, but Cambridge and Peterborough has a population of about 1 million, allocation-wise about 1.7 billion, but in terms of spend, it's because of the large providers and the amount of specialised work and patients that they treat across other systems and nationally, the spend's in excess of 3 billion. In terms of place, we're looking at two places, and obviously provider collaboratives at that place, but four kind of key areas within the county.
You mentioned health and social care. You also mentioned health inequalities, of course. Can you just give us a feel for how you foresee us being able to make some step changes in dealing with health inequalities, but also in terms of the genuine integration with social care?
So there's a couple of things. There's a kind of radical approach that I took when I was working in Leicester for the 3 CCGs and ICB, where we moved away from the primary care, the national funding for primary care, and moved to a patient needs-based formula. So it's 100% driven by patient need. We've put in things like deprivation, communication, all those drivers of health inequalities. And we've effectively then moved to what we feel is a more, obviously patient-focused, but a much more equitable model of funding. So there's, the real radical moving away from those nationally driven formulas, which actually, when we have done lots of studies and analysis on it, how we nationally are funded for primary care was driving up health inequities rather than improving them, because it's obviously based on something as generic as age and gender. There are as well, I encourage people to have real deep conversations, particularly at place level, with the voluntary sector, the amount of work that they can do for such small amounts of money. So we've had a couple of initiatives that we've run over the last couple of of years. One was the 12 Days of Christmas, but one that we've just been doing as a system, which is called Project Launch. So it's trying to make change happen and make our staff and frontline staff be the drivers of that change. And we invited the voluntary sector to come into that kind of transformation opportunity. And, for something as simple as one of the voluntary organisations has agreed to do a 2-year piece of work that targets our Black African community on mental health issues, setting up a sound producing where they go into hospitals and run their DJ, do effectively run their hospital DJ, but they also do a lot of sound sets in the community, and we teach them obviously the skills of sound producing and give them a skill, but at the same time in an environment where they have access to mental health professionals and to start those conversations. That's £30,000 and it's 2 years worth of work. The benefit that the voluntary sector can bring, I think, is massive in terms of that health inequalities agenda. How do we integrate with social care? I think if we all had the answer, we'd be in a different job. I think it's tricky. It's tricky because it's around they have finite levels of funding, and that's the way they manage to it, and they'll change service delivery in order to hit a financial target, which is unusual, isn't it, for the NHS? We don't necessarily work that way. Service delivery has always come first. So I think for me, it's around how do you get the transparency in those decisions, so that we're really clear where is the, looking at the conversation that I was talking about, where's the best value for the Cambridgeshire pound, for the NHS pound, because actually sometimes it might be in social care, because a social care bed at a cost of £700 per week is much better than an acute bed at almost £500 a day. So I think that's how, understanding the costs across the system of health and social care is I think it's a big responsibility for ICBs and finance teams as we move forward.
And I suppose as much as possible then, therefore, to be making the big decisions within social care and health alongside each other, so to get the full context of the decision making that's in front of you, I guess, is kind of the trajectory we're on, isn't it?
It is, and it'll be very interesting because I appreciate that they have elected members and everything else and won't want health to be part of that, but actually let's just have the transparency to start off with, so that we recognise what the impacts are across the two sectors. And I think that would be a big step in the right direction. And then, as you say, being around the table when those decisions are made, to have that ability to influence, not necessarily always making the decision, but to be able to influence that, I think is going to be a real step forward if we can get into that place.
Yeah, so transparency and then context within which we're making decisions, even though we're making decisions across different statutory sectors at this stage. So you've been promoted into one of the 42 new ICB roles, but I'm sure, as you picked up from these In Conversation podcasts, our listeners generally like to hear about the career story, how individuals got to the roles they're in and the career journey they're on. So just wanted to have a quick glide through your career backstory, if that's okay. And so I can see you were finance director before this role at Leicestershire and Rutland CCGs for a couple of years. And before that, you were 10 years at Kettering General Hospital. So 10 years in an acute environment across 4 different roles. Really intrigued to see that before that, you were at Northamptonshire Police. And before that, Cambridgeshire County Council. And even delving a bit deeper into your past, I could see when you were studying for your master's degree at Sheffield, you also did an undergraduate placement for a year at Vauxhall Motors. So you've literally covered pretty much every sector there, I think, Nicci. So that's a broad-ranging CV. So unpack that a bit for us, and give us a bit of insight into what you've learned along the way.
Yeah, I do think I should get a medal or something. I think if you tick all the sectors off, surely there should be some kind of achievement award, I think, to do that. So I kind of fell into accountancy, I guess. Like, I don't know, I've not met anyone where it's been their number one, on the careers day, it's the one thing they woke up when they were 5 years old and said they desperately wanted to do. But as you say, I had a progressive degree in maths just because I enjoyed it. No other reason, and just really interested by it. And then it came to I'd picked a degree where you got a placement year, and the Vauxhall placement was one of the kind of top placements to get. And so went into it as a finance analyst, not really knowing what that was, and just genuinely loved the experience. was offered the opportunity to go back, but the private sector at that time, and particularly manufacturing, was going through quite a lot of change. So I thought, well, I'll see what else is out there on the graduate market, and for me, there's always been something about the private sector of it's relatively easy, and so I quite like the idea of doing something a bit different with constrained resources. And there's a public sector pull from a family background, so I had a couple of opportunities on the table, one with Transport for London, one with Cambridgeshire County Council, and went with the Cambridgeshire County Council, and completely uprooted, moved there, and had a fantastic time, because you got the opportunity to try all different careers. So for everything from audit, which I decided very quickly I didn't like, through to kind of your corporate finance, your financial accounting background, and then management accounts, and really felt at home in management accounts. So stayed there for kind of, I think, probably like 5 years or so, and then was approached actually by Northampton Police, because I'd done the first shared services for the county council, and written the business case about joining Cambridgeshire and Northampton's county council together. So had quite a bit of experience from that perspective, and they were looking at doing the same thing from a back office perspective. So was approached about that, and knew it was going to be a relatively short-term role, but thought it'd be a really good experience. Let's try it in a different sector, see what that was like. On my first day was called Mom, which was really strange. So quickly realised how high. I mean, if we think the NHS is hierarchical, go work for a police force. It's absolutely bizarre. And as I said, merged kind of two devolved finance teams under one. And did a big whole, again, back office shared services approach there.
You're qualified at that point, I understand, is that right?
Yeah, I qualified when I was at Cambridgeshire County Council. So yeah, I qualified as part of the graduate scheme. You had to take 2 exams every 6 months. So it was kind of a fast track to qualification of those heady days of working and studying at the same time. So yeah, I think I got my qualification at about 3 years after joining the graduate scheme. So yeah, went over to Northampton Police, fully qualified, and doing some work with them. And then again, you'll find this with my career, no real career plan. Then via one of the police officers they were talking to, and we're really good friends with a guy called Marcus Thorman, who was the Director of Finance at Kettering at the time, and you'll know him from the Royal Marsden and via Imperial. So he was desperate at Kettering to get business partners in that had worked in different sectors, so wasn't just the typical NHS background. So had a conversation with him, kind of told me about the role, knew nothing about the NHS at the time, and thought, well, why not? Because the project work that I was doing at Northampton was coming to an end, and thought, well, let's give it a try. So joined them as a business partner back in 2010. At a time where I think the business partnering function was very much a new thing. There were very few organisations that were doing it now. It was very much the traditional finance and management accounts. So we spent most of our time, I think, for the first year that we worked there, explaining to people what we were supposed to be doing, and trying to get the team to work differently and to really engage with clinical business units rather than, just reporting and sitting in an office block, but actually, genuinely engaging with them. And then I just stopped at Kettering just because new opportunities kept arising. So, and I always described Kettering Hospital as it's like a family business. It's one of those where you've got some absolutely fantastic people. It was a great grounding, a DGH, medium DGH, so pretty much everything that you could see, and progressed up to the kind of head of financial management at the time, deputy director of finance, and then was looking at different opportunities, thinking I need to go to a bigger trust. I'd done the deputy for a good couple of years, 3 years or so. And then we went into kind of quality special measures, had a big well-led review, was inadequate for well-led. A whole load of transformation support came in, and I thought, well, this seems really interesting. They were looking at an opportunity for a director of transformation, and I thought, well, actually, I constantly said that we should do more, and I thought, well, I'll put my money where my mouth is and actually go out and deliver rather than reporting about things actually. And that's probably, I only ended up doing the role for 6 months, but it was probably the biggest learning curve I've had in my whole career, to take a step out of that finance environment and actually go and really try and deliver through operational teams, and try and to understand and push through genuine productivity and transformation improvements. And then I, due to circumstances that I was completely unaware of, I then got a phone call on a Friday night saying, "Could you come in on the Monday and be the director of finance?" So, so I, at that time, didn't know what plans I had. I'd kind of always wanted to be a director of finance, but maybe not that soon. Was really enjoying the transformation side, but was cajoled into, well, yes, and then walked in on the Monday morning in December 2016 to the director of finance at Kettering, and then kind of acted up for about 6-7 months, and then the role went out, and it was a real competitive process. And at the time, because those were the things that were absolutely done, a trust in it with a big deficit, it felt like it needed someone external and all of that, but managed to hold my own with some of the candidates, and was appointed into that role, and then through the journey of taking on other things. So I took on strategy, which was really quite interesting and unusual, I think, for a director of finance to have that strategy portfolio. And spent 4 years as the director of finance there. Had some some real positives. Obviously, being able to keep us on a improving trajectory from a finance perspective, build up the reputation, get a really good rapport with not just the board, the organisation, but also the kind of regulators, and continued with my love of innovation and efficiencies, and did things like Dragon's Den, that I'm sure there's photos around of me dressed as a dragon somewhere. And then after 4 years, again, was thinking it's about the right time for a change. And Mark Mansfield, who was the director of finance in the region at the time, I had a conversation with him and said, what do you know that's about what's coming up? And he said, "Have you thought about a CCG role?" And I said, "Well, no, I just think it's not exciting enough." And he said, "Oh, I don't know, because these things called ICBs are coming along. So you've got a real opportunity. There's a move to being much more system focused. It's not just a commissioner role." And so again, I had conversations with Leicestershire. I had a fantastic rapport with the chief exec, brand new, really good, forward-thinking exec team over there, and felt like we could really make a difference, particularly on, as I say, that health inequalities agenda, opportunity to do something different, and started that organisation in the middle of COVID. So yeah, met everyone virtually, and then as we've moved into the new ICB space, had the opportunity for the first time, I think, in about 15 years, to actually go back home. Well, it's not home, but go back to where I live, and be able to work in Cambridgeshire, and be a patient and a board member, which I think is really important, that you have at least one or two members of your board that are a part of that population. So really excited. There's some fantastic stuff going on at Cambridgeshire and Peterborough, and excited to have joined that team.
Fantastic. And certainly, I think the bit that I took from, one of the things I took from that, your forward thinking with nature, but ability to be flexible and agile across the way as well. And I think you moving out of finance for that period, although it was only 6 months in the end, but into a director of transformation role, probably says a lot about you, I guess. But I imagine you gained so much from that. But one of the things I wanted to just touch on now, if that's okay, is I saw that prior to university, you spent your teenage years as a lifeguard. So amongst everything you've already said, so amongst all the broad experience you've got in terms of police authority, local authority, private sector Vauxhall Motors, acute sector, commissioning sector, system roles, but you also add to CV lifeguard in there as well. The bit that I found most remarkable was where you described that as being about saving lives and stopping any heavy petting. So I'm going to have to ask you to explain that for our listeners, because I'm a little bit intrigued.
Yeah, I mean, it's a fantastic job. As a 16 to kind of 18-year-old, being a lifeguard is, what more you get to wear shorts and t-shirt on a daily basis, and it didn't feel like it was a hard kind of Saturday job or evening job to do until you start it, and then realise that most swimming pools, and particularly things like any inflatable fun sessions, are just death traps, really. And that at any school holidays, a lifeguard is basically a babysitter. So and the heavy petting is it's it's hilarious. Of all the rules that used to be up on the side of the pool, it's the one that made me laugh the most. That we'd have to blow our whistle if there was heavy petting. No, I never quite asked anyone to quantify what constituted heavy petting, but we used to have these moonlight swims, which started to get an area where you'd have to just keep an eye on certain people anyway. But I think I had a tally at some point. I think I dove in and saved something in the region of about 25, 26, largely kids, people's lives. So that's always good, isn't it? To say that you've been able to do that. And other than that, it was I think that's where my love of pranks came, though, to be fair, from working at a sports centre, because anytime anyone ever left, you'd normally at some stage find all of their gear and find a way of pushing them in and then floating out all of their dry clothes to them on a float. Or most people that left would take a bottle of fairy liquid to the slide, the jets on the slide, and you'd suddenly get quite a few things. I think one of the reasons I knew I was a bit of a rule breaker at the start, there was a red button that said "Do not touch" on it. So as usual, these big signs, and I looked at it for a year and used to get in the staff room just be like, no one ever knew what it was. Everyone that I asked, no one ever knew what it was. And, I was in a particular cheeky mood, I think, one evening, and I said to the other lifeguard that I was on with, I'm going to press it, just see what happens. So pressed it. I was on the next morning and I got a phone call at just before about 5:30 in the morning saying, "Nick, no need to come in. The pool's empty." So, and did you know anything about any, did you see any workmen? There's been workmen about. Did you see anyone or anyone that pressed anything? So I quickly found out what that red button was, which obviously emptied the pools. And I'm sure someone was cursing me of losing out on income for the morning while the pool's refilled.
I'll give them a chance to clean the pool, I guess. But that's fascinating. My son has just finished his GCSEs, but he's a competitive swimmer and he's a triathlete, and he's got nothing to do in the summer. And a couple of days back, I was picking him up from one of his pool sessions, and I noticed they've got they're advertising for lifeguards 16 and above, and of course he's 16. So, and I said to him, what could be easier than sat there, observing people and occasionally maybe diving in, blowing the whistle and so on. But obviously there's a bit more to it than I'd expected, Nicci. So I'll share some of this with him this evening.
It's a great for a Saturday job, but much better than working in a shop or anything like that. I had a great time.
But don't press that red button, right? It was a red button.
Yeah, don't, anything that says "do not press," don't press it.
Excellent. Right, and I mentioned at the start that you're also the current holder and most recent winner in an all-female shortlist, not least, of the HFMA Finance Director of the Year Award last year, where you were described as an exemplary and innovative leader who's made an impact at local and national level. On several fronts, Nicci, not least primary care, but also tackling broader health inequality, addressing a significant system deficit, bringing 3 finance teams together as part of that role, and championing diversity and inclusion. So first of all, congratulations. What I'd like to do, if that's okay with you, for those that maybe haven't had a chance to have a look at the awards briefing that HFMA always do very well after these events, could you just unpack for us a bit more about how you became nominated, and some of the reasons behind the decision to award that accolade to you, and really just why are you so proud to be Finance Director of the Year, Nicci?
So I still don't think it's quite sunk in. It's pretty overwhelming. I think I was just absolutely made up and buzzing to be on the shortlist, to be honest, and to be on there with 2 other fantastic female CFOs. I think is a real positive for HFMA, and something to be really proud of, to have that all female shortlist. And to be honest, I said it at the time, my money was on Sue. I think she's done some fantastic stuff. Obviously, quite a neighbouring system as well, so had watched from afar at how some of the brilliant things that she'd been doing. So yeah, it was a real shock, and actually I was just quite happy to have made the shortlist, and so that in itself was an achievement. How it came about, I think, was just during COVID. Obviously, there was, with regards to the finance regime, there's very little opportunity to do things. It was very much nationally led, wasn't it? And I sat with our chief exec at the time and the board, and they just said, actually, do you know what? In the inner city, GPs have been saying they've been underfunded for years. How about, because we've got a bit of time, a bit of headspace, can you look into it and see if there's anything to it and what the opportunities are? And by the way, we've got this fantastic retired GP and a brilliant population health head of population health management who've been working on a model, that a different way of funding primary care, see if there's anything in it and what we could do. So that effectively in about 6 months then became the LLR primary care funding model, of which we then so I led a big task and finish group, extensive amounts of engagement, and we rolled it out, managed to start the project in October, get some fantastic people. Just a case of really trying to manage those funding flows, really, I think was the key to unlocking it all. Actually, a whole load of other people had done some brilliant, innovative work. It was just me coming along to kind of unlock the finances around it. And because of that, it's the first one that has been done nationally. It brought a lot of attention from people who have a fantastic relationship now with Dr. Bola Olawabi, who's the Director of Health Inequalities for NHSIE, been working with the Health Foundation, and last week had phone calls with Number 10, which was quite interesting and really unusual place, and just bizarre to find that we're having those kind of conversations and starting to roll the model out in other areas, which is real positive. So I think that's one of the big pieces of work, and for me it was just the opportunity to really do something different. From a finance perspective, while COVID was just being driven very, very nationally. I think the second reason is just my approach to innovation. So yes, I appreciate that there are big schemes and big ways of doing transformation, and the productivity agenda and GIRFT and everything else. But to me, you engage people by making it fun and by getting the frontline people in the organisation. So at Kettering for 2 years, I'd done Dragon's Den. 200 odd people in the audience, lots of ideas, and some fantastic, pictures that have come out the back of that. And some, we've won awards nationally for some of the things that happened. So moving a thoracoscopy procedure from 5 days length of stay to doing it in a day case, things like that. Being able to say that you've been behind initiatives by just, again, offering £100,000 it was at the time. People didn't have to write, I don't like to, let's stop the endless form filling, don't project manage the life out of everything. Just made it dead easy, and people could put in video pictures. They came and did presentation, removed PowerPoint, weren't allowed to use that, just actually use themselves, and actually clinicians and frontline staff really appreciated it because they don't have time to fill in a form, and they came and just did some brilliant pictures. Brought that into LLR and did 12 Days of Christmas. Again, with COVID and everything else, everyone said, everyone will be too busy. I don't think it's going to work. We gave out £5,000 a day for the 12 days leading up to Christmas on ideas that would help improve staff health and wellbeing, patient experience, transform services. And we had 70 ideas, at a time when it was the busiest time, just because people could see that there's opportunities on the back of it. And then we've just managed to be really, really fortunate in having the funding last year to create a Project Boost, which is where we set aside just under 2 million for, again, ideas from frontline staff. So basically said to them, you know the ideas the best, ways in which you can improve and better patient care. How could you do it? And tell us how you can do it, and we'll support you in being able to do that. So make them the project managers, and it's brilliant. Some of the great things isn't just the successes. We've got buzzy shots and some of the stuff, and we've some activities with wheelchair groups. But actually, for me, it was a HCA that is now halfway through her qualifications to becoming a nurse, because someone believed that she could. And she, on the back of her successful bid at Dragon's Den, took that to say, well, actually, do you know what? I can do more than what I'm doing, and people are willing to listen to me. So I think, the innovation side is also one of the things, and then also some of the leadership work that I've done, not just with my team, joining a team when you meet them all virtually for the first year and a half is very strange. I write a blog every week, which is telling them about things that I'm sitting on, things that I think that they would find interesting, and also just, engaging in the general news and other things, and trying to make people laugh a little bit as well, and telling them a bit about me. And also we use it as a way to have a shout out to people who've done something really good, and where people aren't often thanked enough. So I think it's gone down really well. It really worked in COVID, of being able to keep in touch with the team. And then I do quite a lot of work now with, and being able to, fortunate enough to do some work with the HFMA and some of the regional groups for EDI. I chair the digital committee. I worked with HFMA on the policy and research group, and do some of those kind of leadership events, and they're brilliant because it just keeps your mind open to the new things that are going on, and all the things that HFMA are involved in, but all the things that you as a finance professional can get involved in as well. And it helps keep up networks. People think that networking is just rocking up to a conference and having a conversation. Actually, some of the best networks that you develop are through HFMA and those regional groups. And there's so many people, myself included, that are willing to give their time. When you're starting out in some of these roles, and when you're more junior, you feel like you're taking up people's time, and they're always busy, and their diaries are back to back. But actually, everyone that I've ever spoke to or worked with or developed networks with have absolutely been more than willing to give their time. And I think all of us are, if it's a way of helping the next, cohort of people coming through. It's absolutely something that all of us are willing to give our time to. I've had some fantastic, mentors, but just as you say, people that you can pick up the phone to that don't necessarily fill a formal role, but have then exposed you and opened you up to different other networks where you then meet different people. And as I say, I was probably one of those people that was always worried about going to the HFMA conference because you didn't know anyone, but you now find, because you do the work outside that meeting in other groups, that actually you go to those events, and it's a really good opportunity to actually catch up and see how everyone is in a more informal environment.
Yeah, no, I totally agree. Especially actually the informal networking in the way you described, not necessarily formal coaches and mentors. The bit I wanted to probably come back to is you mentioned in there that you chair the Midlands Equality, Diversity and Inclusion Ambassadors Network. I kind of just wanted to just pause on that for a second in terms of the role of the network, what change you've been able to influence along the way, and where and really some of the impact you've been able to make, I guess, looking into the future as well.
Yeah, so obviously I'll be moving regions, so I'll be handing that baton over to someone. And I think for me, the benefit of those networks is being able to have, a place where we can push the inclusion agenda forward, and also for people to be able to take tips and hints of other organisations that are either ahead of them or doing something slightly differently. So it's around how all of the things that are in the kind of One Finance agenda around how do we look and be more inclusive on our recruitment. What approaches are people taking to that? What approaches are people taking to things like sponsorship, and reverse mentoring, and all of those areas. I've myself done the kind of reverse mentoring. It's fantastic. Everyone should do it. It's brilliant. But it's been able to hear about some organisations that are talking a lot with the EDI network up in the Northwest is much more established than the Midlands one, and the work that they've been able to do and share best practice as well. And also it's one of those networks that you don't need to have a senior management title to be part of. You can be anyone in that organisation with an interest and be able to influence it. And also it's been able to then to access a lot of the One NHS Finance information, so that you can, and obviously trying to build up that ambassador network that go back into the organisation or ambassadors for EDI. How I've managed to do anything, I think it's not through policies or procedures, because all of us could talk about things we've done in that. I think for me it's about role modelling it. It's taking the time to listen. I think one of the biggest things that we should be doing as leaders is listening, and listening more. and then being able to build on what we've heard and what feedback we're given, and then role modeling it. It's being able to talk about your personal life, to talk about experiences, to be really comfortable, and people seeing that you're comfortable having those conversations. So as you'll have seen in most of the presentations that I've done, I had struggles with COVID trying to get married for 2 or 3 times, but I'm quite happy to put it out there. I got married to my wife over just under a year ago now, and absolutely sharing experiences like that. It seems really simple, but actually that's had a really powerful impact on quite a few people who've come and spoken to me on the back of it. So I think a lot of it is that being a champion, role modeling it, and most importantly, listening.
So what's next for you? Obviously, you're in the new job now. What's kind of your ambition for the future? Was that just a no plans basis and just see what happens next?
Yeah, my career's managed all right so far without doing too much planning. Couple of things thinking about, obviously getting my 40th birthday out of the way. That's passing that milestone, and then I'm really looking forward to going over to Cambridge and Peterborough. It'll be the first time in the NHS in a new region, so I think that'll be quite interesting. Obviously, continuing the work that we're doing with HFMA. I do want to start to look at that, how really how we can drive the health inequalities agenda, how finance can lead that lead through those pieces of work and continue to push those things. Engagement, as you said, is a massive. Just I think that the more that we can do, and to make the finance role be much more than just finance and technical finance, and to really engage with all staff, but also communities in particular. So I'm really excited from a ICB perspective of how we get through those kind of place and into the communities and people that we are here to serve ultimately. And I think the innovation, trying to still find ways to make it fun and engage people. But I'd like to think that part of all of our jobs over the next couple of years is to take care of our staff. I'm really concerned about health and well-being. So I think my number one priority actually is how do we protect our teams? How do we make sure there are people that want to follow in our footsteps? Because at the minute, it probably doesn't feel like something that they want to do, or an exciting or attractive prospect. So how do we make that more possible, and how do we bring some of the work-life balance back and make sure that it's okay for people to take care of themselves? So I think that would be the first thing on my agenda. Actually, I think should be on all of our agendas, because I am concerned about burnout of teams just because of the sheer volume and scale of work that we're trying to get through at the minute.
So listen, I actually thought it'd be nice at this part of the podcast maybe just to get to know a bit more about you, Nicci. So I hear you're a sports fan.
Yeah, I'm a massive Liverpool fan. Which used to be I used to apologise for it because we didn't win anything. I was born in '82, so literally towards the end of where they were good, and then spent 20 years pretty much just ruin Man United, and who pretty much spent most of the time at the top. So Man United and Chelsea, but now I'm actually can celebrate the fact that I'm a Liverpool fan. We're back into winning ways. I did used to play football quite competitively in my younger days. It was always, two truths and a lie I'd represented my country in 2 sports. One of them was football. The second one, no one will ever guess, and I'll probably open myself up to some serious Mickey taking, is synchronized swimming was the second one. So,
wow.
Yeah, I'm generally into most sports. I'll watch if the sport's on TV. I'll generally watch it, but yeah, I quite like the NFL as well. Which so football in both senses, the American use of the word and the British use of the word would be my favourites at the minute.
Oh, excellent, fantastic! There was a claim to fame involving Prince Harry as well in there somewhere.
Oh yeah, so yes, my friends often joke that whenever we go out or do something, I seem to just randomly attract celebrities. I was stood in a queue for a bar at an airport, and Michael Portillo was in front of me, which so just strange things seem to happen to me more than anyone else. But where I was at the Invictus Games, so my cousin's husband is in the in the army, and quite a number of his colleagues who were really badly injured in Afghanistan were taking part in the first Invictus game. So we went along just to support, really, and happened to be stood outside the toilets as Prince Harry walked out. And so completely ignored all royal protocol and asked him for a photograph and gave him a hug and everything like that. So yeah, it was fantastic. It was he was a really nice guy. Stood chatting to us for kind of 10-15 minutes. Probably thought we were slightly bonkers, but yeah. So we've got a very bad photo of myself with Prince Harry. He looks all right. Me and my friend look a bit, dumbstruck, to be fair.
Excellent. Oh, what a great story. Fantastic. Right, we're on to the quick fire round now, Nicci, if that's okay. No need to explain your answer, but you can if you wish. But the first one is what were you doing immediately before this conversation?
I was literally running. I ran inside while I've got a garden office, so I ran into the house to get a cup of soup and and a bite of a sandwich because I had 15 minutes, so that's what I was doing.
Excellent. And second one I've got, what's the last book you read, or the book that you're reading now?
The last book that I read was a Jodie Picoult, is it Small Things or These Small Things? The one I'm reading now is Miriam Margolyes's autobiography, which is hilarious and not for the faint-hearted, I'd suggest. But more sensible book, the two books that have probably had the most impact, I think, on me that I've read in the last couple of months is Invisible Women, which is about how data ignores females, basically, and how the world is geared up, and there's some really hard hitting facts. So females are 49% more likely to be seriously injured in a car accident than male. So because of the way that seatbelts are set up. And then the other one that I've read that's a really big is The Good Immigrant, which again is a brilliant book. But so you can see quite eclectic on books, from hard-hitting, sensible, serious ones to the bonkersness of Miriam Margolyes and a bit of Jodie Picoult in between.
Indeed. Nicci, we're coming to the end of our time together. I really enjoyed our conversation, actually. I hope our listeners have got to know you a bit more, actually. I certainly have. And I'm sure we'll continue to follow you and watch you into the future. I certainly will anyway. Happy big birthday for a few weeks' time when that comes up. Thank you for being part of HFMA In Conversation podcast with me, Nicci. I really enjoyed it. And to everyone listening, thank you for choosing HFMA Talk. And as I said at the start, if you're enjoying listening to this new In Conversation series, please do spread the word as well as subscribing to HFMA Talk on your podcast app. And if there's anyone else that you'd like me to have a conversation with, then get in touch also. But for now, goodbye.